All right, today we're tackling a topic that so many people deal with but don't always understand. That sudden, sharp, shocking pain that can shoot down your leg out of nowhere. Let's jump right in and unpack what's really going on.
So, does this sound familiar? That zinging electric feeling that starts in your lower back and just travels right down your leg, sometimes all the way to your toes? If you're nodding along, believe me, you are not the only one.
In fact, it's way more common than you might think. We're talking about 3 to 5% of the entire population. It's an issue that often pops up in midlife and can really send you looking for answers.
Now, there's a medical term for this, and it's lumbar radiculopathy. It sounds complicated, but it's actually pretty simple. Lumbar refers to your lower back, and radiculopathy just means a nerve is getting pinched or irritated. So what's doing the pinching? Let's get into the mechanics of what's happening inside your back to cause that shocking leg pain.
So at its heart, this pain is all about a nerve root getting squeezed. And the number one cause? A herniated disc. Think of the discs as these little jelly donuts between your vertebrae. Sometimes the jelly part pushes out and presses right on a nerve. But it's not the only cause. You can also get it from age-related stuff like overgrown joint tissue or even a vertebra slipping forward. And in some really rare cases, it could be something like an infection or a tumor. Okay, so to fix the problem, you have to find it first, right? And this is where your doctor puts on their detective hat to follow the clues and pinpoint exactly where that pain is coming from. This whole investigation really follows 3 main steps. It starts with a hands-on physical exam, then moves to mapping out the pain, and finally, it's about getting a crystal clear look inside your spine. So, step 1. The process kicks off with a physical exam. Your doctor will check your muscle strength, your reflexes, and how well you can feel touch in different spots. They'll probably also do some specific moves, like Laseg sign. That's where they gently lift your leg while you're lying down. If that move triggers that familiar zinging pain, it's a huge clue that a nerve root is definitely irritated. And this is where it gets really, really cool. This is what's called a dermatome map. You can think of it like a complete wiring diagram for your body. See, every little patch of skin on your leg is hardwired to a very specific nerve root coming out of your spine. So just by you pointing to exactly where it hurts, a doctor can trace that pain all the way back to the source. It's just a brilliant piece of human engineering, isn't it? And this right here, this is the final piece of the puzzle, getting that internal view. And MRI is the best tool we have for this. So in image A, you're looking at the spine from the side, and you can see that disc is really bulging out. But the real smoking gun, the aha moment, is in image B. That's a cross-section, looking down the barrel, so to speak. And that little red arrow, it's pointing to the exact spot where the disc is physically squishing that nerve. That's the culprit, right there.
Okay, so once the problem's been identified, the next question is, what do we do about it? Well, the journey to relief begins. And for most people, it definitely doesn't start in an operating room.
And that's a really crucial point. Almost all clinical guidelines say the same thing. Try the non-surgical stuff first. It's often called conservative management, and the idea is to give your body a chance to do what it does best, heal itself.
So what does that actually look like? Well, these first-line treatments are all about calming down the inflammation and getting you moving better. We're talking about things like anti-inflammatory meds, NSAIDs, or sometimes oral steroids, and really importantly, staying active. Specific physical therapy like McKenzie exercises can also work wonders for immediate relief. Now, if that first round of treatment doesn't quite do the trick, the next step is often a targeted spinal injection. This is where a doctor uses imaging to guide a needle and deliver powerful anti-inflammatory medicine right to the problem spot. And these shots do double duty. They can give you significant, longer-lasting pain relief, and they also confirm, yep, we've got the right spot. But let's be realistic. Sometimes conservative care just isn't enough to get you back on your feet. And that's when the conversation might start to turn towards surgery.
This is the big question on a lot of patients' minds, right? When have you given it enough time, and when does it make sense to think about a more direct fix? Generally speaking, the rule of thumb is about 4 to 8 weeks. If you've tried the non-surgical treatments for that long and you're still not seeing major improvements, especially if your symptoms are severe and really messing with your daily life, then surgery becomes a very reasonable thing to discuss. And the main surgery we're talking about is called a discectomy. It's amazing to see how much this procedure has changed over the years.
I mean, look at this timeline. It all started back in 1939 as a pretty major open surgery. Then, by the 70s, surgeons started using microscopes to be more precise. And then, a huge leap in 1997 with the development of microendoscopic techniques, using tiny cameras and tubes for a much less invasive approach.
So let's compare those two main styles. With traditional open surgery, you have a bigger incision down the middle, and the surgeon has to peel the muscle off the bone. The upside? They get a big, wide-open view. Now, with the modern, minimally invasive approach, the incision is tiny and off to the side. Instead of cutting muscle, the surgeon just gently splits the muscle fibers. The result is way less tissue damage and a faster recovery. But there's a trade-off. The surgeon is now working through a small tube, so their view is much more like looking through a keyhole.
Okay, we have covered a ton of ground. So, after all of that, what are the most important things you need to remember as you navigate all this? This might be the single most hopeful and reassuring piece of information. It comes from a massive landmark study called the SPORT trial, and what they found was incredible. Over the long haul, most patients get better, period. Whether they had surgery or not, both groups saw huge improvements. It tells us that for a lot of people, time and patience are powerful healers. And that really is the bottom line here. It doesn't matter if your path involves physical therapy or injections or surgery. The crucial thing to know is that there is a clear and effective path to getting better. Just understanding what's happening is the first and honestly the most powerful step.
Okay, now, with all of that said, I need you to listen very carefully to this part. It is absolutely critical to know the emergency red flags. If you ever feel numbness in the groin or buttock area, what doctors call saddle anesthesia, or if you suddenly lose control of your bowel or bladder, or you experience a sudden severe weakness in your leg or foot, you need to get to an ER immediately. These are not wait-and-see symptoms. They can signal a very serious condition that needs urgent care. So, we've walked through the detective work, we've looked at the different paths to relief, and we've covered the warning signs. The big question left is, now that you're armed with all this knowledge, what's your next step in taking charge of your own health? Thanks for tuning in.